Yeah, so dear colleagues, my name is again Жеребцов. I represent Research and Development Center for Biomedical Photonics from Orlov State University. In this work, we explored a new way of using fluorescence lifetime measurements to characterize kidney ischemia during minimally invasive operation. I should emphasize that the experimental work has become feasible due to fascinating facilities of clinical hospital of St. Luca in St. Petersburg. And all the measurements conducted here, presented in this presentation, have been done there with the colleagues, with the surgeons. So what could we get if in real time we could quantitatively monitor the metabolic activity and potentially viability of cells in an arbitrary area of organ? So for surgeon and anesthesiologist, that could provide real-time feedback. For example, when we keep an eye on ischemia applied to an organ, that would make it possible to optimize the ischemia procedure and, if needed, potentially expand the scope of the surgical intervention, because surgery that's maybe quite unpredictable. So we need extra time, or we can finish earlier. And if we could more flexible do that and have some real feedback from the organ, that would be really fantastic. And in final aim, of course, we'd like to reduce complications and improve overall outcome of the surgical treatment. How to solve that challenge? So we know that cells on fluorescence carries important information about metabolism. Let's talk a little about that. Why and how the information can be obtained and used. It's known that some important cofactors for metabolism in the cell have a strong intrinsic fluorescence. For example, some reduced form of NAD involved in energy production in cells. Those forms fluoresce quite brightly when excited in soft ultraviolet light. The same molecule, but connected to phosphate group, is a key element of the cell's antioxidant defense. So the problem is that simply registering the brightness of fluorescence isn't enough to provide more or less reliable information about the content and mutual balance between those two substances. But these become possible if more sophisticated methods are applied. We know that if we initiate fluorescence with a very short laser pulse, and by collecting individual photons to watch how it quenches in time, we can quantitatively distinguish between NADH and NADPH, and also see some degree of connection of these substantive proteins. So on the one hand, we can characterize energy production mechanisms of cell, and on the other hand, we can characterize antioxidative protection of cells. Both of those processes are crucial in characterizing organ during ischemia. It turns out that this information about the metabolism is hidden in the form of curve along which fluorescence decays. Through this process is very fast, and everything goes out in a few seconds, but it's not any problem at the moment to characterize and to register that information. Actually, here we record 4 independent parameters. 2 lifetime parameters, parameter of the fraction of the fluorescence between those two components of the fluorescence, and overall intensity. So all the parameters carry some information about metabolism. In addition to the information, what happens in the cells, it's also crucial to understand what conditions they are in. For example, what is the blood saturation in the area of tissue of interest to us. And we can characterize that optically using the white light reflection spectrum. Basically, here we do fitting of the spectral curves to reconstruct blood filling and oxygen saturation in this area spectrum. In order to combine all these ideas and make them available to at least some preliminary tests in vivo and situ, we have developed several thin like optical probes in which several measurement optical channels are combined together. These probes are combined, so these probes are compatible with cheaper type transcutaneous biopsy needles. And in previous work, we have already shown that we can reliably identify and distinguish liver tumors using them. The probe is connected to the measuring setup developed by us and consisting of photon counting optoelectronics and picosecond ultraviolet laser, pretty much standard configuration for Beck and Hickel. And in this work, we're talking about how we used all that arrangements to assess the state of the kidney parenchyma during ischemia. For what? Many operations on kidney are conducted under so-called warm ischemia. During the procedure, the blood supply of the organ is stopped by arterial occlusion, but the organ is still in warm conditions. It's not in ice. So in normal situation, only 20 or 30 minutes should be expected, maximum duration of the occlusion of the warm ischemia to prevent long-term renal dysfunction. That might be pretty much dangerous if we keep it more. So we believe that in future, some kind of optical sensor located on the organ could give real-time feedback to surgeon about current status of the organ tissues. More adaptive procedure will allow to reduce complications and provide better outcome of the treatment. In this study, patients who underwent organ-preserving surgery due to renal cancer were divided into two groups, one of which was administered with 15% sodium fumarate by intravenous infusion. Why fumarate? That substance prevents complications after the post-ischemic complications. Why? Recently, it has been discovered that cells lacking oxygen reduction accumulate ubiquinol, and that drives succinate dehydrogenase in reverse to enable electron deposition to fumarate. So fumarate basically works like an like oxygen in this quite ridiculous situation. So the kidney under that conditions can survive longer. But can we see some differences in the kidney tissues due to that protective mechanism? To characterize that, measurements on the parenchyma of the kidney were performed before the onset of warm ischemia, during ischemia, and also after the separation of blood flow in the renal artery. The saturation channel recorded regular changes in the oxygen content in the blood of the tissue. So what we expected, decrease during the ischemia and recovery after the release of occlusion. These two graphs B and C show changes in the form of NADH not bound to protein. This is a characteristic in this case of energy production. The most interesting result is not absolute values, but that we register that sodium fumarate smooth out ischemic changes at the level of cell metabolism, and we can record that almost in real time. We see the same thing in the second group of graphs that characterize the antioxidant defense of the cells here, where we characterize fractional fluorescence intensity from the free NADH and fluorescence lifetime parameter tau2. This is about antioxidant defense. So this work can rather be called preliminary, and it's maybe too early to talk about its real application in practice. However, the fact that even now we can reliably record the state of cells during ischemia, during a real surgical operation is very encouraging us. So thank you for attention, and this work has been supported by Russian Science Foundation. Thank you.